Hello everyone. Today we will talk about the body mechanism. So body mechanism or body mechanics, we can say how we are using our body while we do the physical activity like walking, running, or when we are lifting something from one place to another place. When we want to do the transportation also. So how we are using our body, okay, for transporting the object or anything. So that is what it means about the body mechanics. So in that, first of all, we'll see the definition. So body mechanics is the efficient use of the body as a machine and as a means of the locomotor. Locomotor, it means doing the physical activity. Okay, so how you are using your body while you do any kind of activity. If we want to lift something, so how you are lifting that? Okay, you are giving your whole strength for lifting that, or only you are using your just little strength. So this all the kind of thing is so much important when we deal with the patient. Okay, because when we want to shift the patient from one place to another place, that time also nurses have to use their strength. Okay, energy they have to use. Even though when we want to take some articles, or is there any big machine is there and that we want to lift, or we want to transport from one place to another place, that time also we have to use our own whole body's strength for pushing that machine. Okay, so how you are using that, all this body mechanics, it is about this. Okay, so as we know that we are using our body as a machine, as a robot also we know. So robot, what it do? They also use their body to do some activity. Okay, so as a machine we have to use the body, but that is also in an efficient way, because if nurses don't use in a proper manner of their body, okay, or the body mechanics, if they don't maintain, then they will have a more strain on their body, or muscular pain and backache and leg pain, everything will be there. Okay, so we want to reduce this all kind of things for the nurses. So that's why this topic is so important to learn about. Okay, now we will talk about the advantages. So what is the advantages for that? So maintain good body alignment. So maintaining a good body alignment, it is so much important. Okay, when you go for for doing any nursing procedure, if the patient is lie down on a supine position and you are not maintaining, if you are not maintaining proper distance from the patient, if you are standing like 10 centimeter away and you are doing the procedure, okay, so what happens? Your body is going to use more energy. Okay, but instead of doing that, if you are standing nearby the patient and you are doing the activity, then what happens? Your body is going to use very less amount of the energy. So by that also good body alignment also you can maintain. Then after the maintain the balance of the body. Okay, when we want to lift very heavy instrument, or any articles is there, or we want to transport one article or any object from one place to another place. So what happens? We are going to use, if we want to lift anything, so we will use both the hand strength. Okay, we will use both the energy of the hand. But instead of doing that, you are using only less amount of the one hand and you are using more strength from another hand. So imbalance will be there. So by that, what happens? If the balance is not equal, the imbalance will be there and nurses can fall also. Okay, so we don't want to have such kind of things. Then after, prevent fatigue and the deformity. So prevent fatigue, it means that why? Because if you're using your extra energy, then of course energy has been used from your body, then you will feel the very weakness, otherwise the fatigue will be there. Okay, and if we are not maintaining the alignment properly, then for a prolonged time, if you are not maintaining, then in the later time, after the 10 years or 20 years, the nurses can suffer from any spinal deformities, as like kyphosis, lordosis. Okay, so what happens? Normally the spinal cord will be like straight. Okay, a little curvy will be there, but instead of that, like this is there. Okay, spinal cord. Okay, so that is a deformity of we can say deformity of the spinal cord. So this kind of physical deformity can be there if you don't use the proper amount or a properly body alignment. Then after, promote the physiological function of the body. So this also provide the it is help to do some good activity also. So physiology of the body also going to be maintained. Then after, reduce the expenditure of the energy. So this also how much energy has to be used for a particular article, so it will reduce also. Okay, they will make you understand, okay, if I'm lifting this article like this, if I'm doing this procedure this way, okay, so this is helping me to me to make more confident also and efficient also. Okay, then prevents and reduce the risk of the musculoskeletal injury. As I have told earlier, if we are not maintaining proper body alignment, so what happens, the injury, the muscle strain will be there, muscle tear also can be there. Okay, so this kind of muscle, even though sometimes if you have fallen down also, the crack or the fracture can be there. So musculoskeletal injury, we can prevent it if we use in a proper way. So this all are the advantages. Now there has been some principle has been given for the body mechanics. So in that some principles are there, we'll see one by one. So here the principle has been given, what is the rationale behind it, and the one example has been given. So by example you will understand that principle very well. So in that, when planning a transfer or move, free the surrounding area of the obstacle. So what it means, when we are planning to move something from one place to another place, if I want to transfer this table or this tables from one place to another place, what I'll do, first I will go there and I will see whether that space is available for transferring there or not. If place is not available, how you will keep this article there? Okay, so make sure the surrounding or any obstacle is not there. Okay, any difficulty should not be come around. So what is the rationale behind this? Appropriate preparation prevents potential falls and injury and safeguard the patient and the equipment. Okay, so what happened if we want to transfer the patient, okay, and something is there on the bed. So what happens, you are transferring the patient and you have not noticed that something is there on the bed. So maybe patient can also fall, okay, and even though the nurses also can have some injury also. So if you are checking this all the things, so you can prevent some this kind of things to happen. Now the one example has been given, make sure that path is clear of the obstacle whenever planning a transfer or a move. Okay, one more example I can give for this. If you are transferring a patient and patient is on a stretcher, okay, but there is a notice has been there on a floor, maybe something has spilled over the floor, and there is a one caution, the board has been there, okay, the board is there on the floor, that the floor is a wet, okay, and still you are just going from there. Okay, so you know there is a caution board is there and you can't go. So if you go, then what happens, you will fall because of the slippery floor. So like this obstacle or any difficulty come around, then the patient also will get suffer, and you the nurses also can get suffer. So make sure the obstacle is there, you has to be removed first, then go for the transfer. Then after the second principle, the heavier an object and the greater the force needed to move the object. Okay, so if any instrument or any machine is very heavier, okay, so for that you have to use the extra energy. Okay, so in that the rationale has been given, that is a normal phenomena. If you want to lift any small object, then that time we don't need to use extra energy, but when we are using or when we are lifting any heavier item, of course we have to use the extra strength, right? So in that rationale has been given, using a mechanical device or assistant to move the object reduce muscular effort and prevent the injury. So what happens when the any object is heavier, that time we take some help from the others also. Why? Because all the strength or maybe the item is very heavier, you can't lift alone. So that time you also have to, if you will try to lift that material or any article or something, so all the strength will come on your back or on your feet, so eventually you will have the backache. So that's why you ask the help someone to lift that article. Okay, so by that also no strain will be on the back. So use cot key when the lowering or the elevating the bed of the patient while lifting or moving. Okay, so here one example has been given. When we want to transfer patient from cot to stretcher. Okay, so that time the bed, if we have given the high Fowler position or some position we have given, to make sure you are elevating or you are lowering that bed. Okay, if you are just shifting like that, if the bed is not flat, okay, and it has some 90 or 35 degree is there, and still you are shifting patient from one place to another place, so that time you have to use extra effort. Okay, so make sure you are lowering the side. So if you are lowering that, then easily, if the bed or the mattress is flat, you can easily lift the patient from one place to another place. Then encourage the patient to assist as much as possible by pushing or pulling themselves to reduce the nurse's effort. So what happens if the patient is conscious, patient don't have any physical restriction for doing any activity, restriction is not there for activity, so that time you can ask the patient to roll also, or they can you can push them also. Okay, pull, otherwise you can push them. So by that also the strain or the extra effort will be reduced for the nurses. So here you can see the nurse is trying to shift the this kind of she is shifting. Okay, so that time she has to use equal amount of pressure also. So both the hands she has placed, okay, and gently they are pushing. Okay, and balance of the both the legs is also important for this. Okay, now object that third one we are talking about, object are the closed to the center of gravity are moved with least effort. So what happens, object that are close, which object are really close to us, make sure you make them to lie on a center of that part. Okay, if something is there at the edge of the bed or edge of the table, if I'm taking that, so more strength will be used for taking from the edge of that. But that object, if you are making to come at the center of the bed or table, what happens, it need very less strength. Okay, so that is what it talk about. So bringing the center of the gravity of the object close to the center of gravity of the person prevents the unnecessary strain on the muscle. Same thing, if you are taking something from the center of gravity, it takes only less amount of the energy, so less strain will be there. Then after, one example has been given, adjust the working area to the waist level. Okay, something, if you want to do the procedure, okay, if the patient bed is very low, so what you have to do, you have to bend your back very much, you have to bend the back. Okay, but if it is on a working level, so what happens, you no need to do you no need to bend yourself extra. Okay, so like that. So lowering the side rails while making a bed or shifting the patient from bed to the wheelchair. Okay, so what happens, if you are if you are doing the bed making, okay, and side rails are up, so what happens, you have to lean more on the bed and you have to do all the activities, but side rails are lower. If it is a low, then what happens, you can do all the activity at very easily. Okay, here you no need to use also extra effort to make the bed. If the side rails are up, of course you have to use your extra efforts for that. So by that, what happens, prevents the stretching, reaching and injury to the lower back. So that's why we have to do. So by that we can prevent the stretching also. Overstretching of the muscles can be prevented. Then overreaching also can be prevented, and the injury to the lower back. Now, holding the object close to the body when the moving or lifting them. So holding object very close to the body. If I want to lift anything, if I'm holding like this, of course it needs more effort. But if I will make that object to come very closely, so what happens? You need to use very less amount of the effort. So this is about the third one. So here the nurse is trying to keep something over the shelf. The shelf has been there and she is keeping something there. So that time also overreaching should not be there. Okay, make sure the working level are at the level of that. So you no need to use more efforts. Now fourth one, effective use of the major muscles while carrying heavy object minimizes strain on the abdominal and the back. So what happens when we hold something, that time we will use the two muscles more. That is, one is from a back side, the muscle of the back, and the abdominal muscle. Okay, so this both muscles will be used more when we lift any heavy object. So in that, what is the rationale behind that? So facing the direction of the movement avoids twisting and help to maintain body balance. So facing the direction, so where I want to move, okay, if I want to go straight, make sure you are maintaining your movement and your direction very easily. Okay, if you are not keeping that, so maybe the twisting also can be there. So twisting, it can avoid the twisting also. Okay, and help to maintain the body balance. If I want to go this side, I will see that side only. If I'm carrying the article and I'm looking somewhere, so what happened? The twisting also can be there. You can fall or you can have the injury, and you can have a imbalance also. Okay, so for that. Now example is that while carrying the heavy object, moving the feet towards the direction instead of moving upper body, minimize the muscle strain on the abdomen and the back and twist and avoid the twisting. So here what it has written, while we carry the object, so when we are making some movement, make sure you are not only using the upper portion of your body, make sure you are using the lower part of your body also. If both the things can simultaneously, if both the things, upper part and the lower part, if they work simultaneously, you will have a very less amount of the strength. Okay, so by that also you can reduce some strain over the back also and over the abdomen also. Okay, see what happens when we carrying some articles or when we are moving some machine. So that time what happens, sometimes we are pushing more. Okay, so that time we will use more back. Okay, so back strain will be there, but that time we are not using our legs properly in the same direction, so strain also will come there. So if we are maintaining this direction or this simultaneously, then the force will be used very less. Okay, so here some natural or how we have to do the body mechanism or the mechanics that has been there. So this is the natural or the neutral posture is like this. Normally any person will stand like this. Okay, so this is the upward position, this is the back flexion and the back extension. So if like this, if we are bending, so that is known as a back flexion, and if we are moving a little or leaning forward, so that is like this back flexion. Okay, then after twisting about the wrist, so when we twist like this, so that is a twisting about the wrist. Then after the lateral bending is like that you are bending your one shoulder down and one shoulder upside. Okay, so these are the some mechanics you can use. Then after fifth one, balance is maintained and muscle strain is avoided as long as the line of gravity passes through the base of the support. So balance is maintained and muscle strain is avoided. So balance, of course, when we are moving something, or when we are when we are transferring something, one patient to another patient or something, that time the balance has to be maintained very properly. Okay, and the muscle strain is avoided. So here, standing as close as possible to the object, avoid stretching, overreaching, and the twisting, which may place the line of the gravity outside the base of the support. So here one example has been given. By that you will understand this principle very nicely. So arranging the article near to the patient's bed before starting the procedure. Okay, so what happens if I want to do the procedure? Okay, but the articles, that is a normal preliminary things which we are doing. We are making sure that all the articles are there nearby the patient's bed. Okay, if it is nearby, so you can assess that, take the articles very easily. Okay, but it is, if it is a very far of your reaching area, so what happen? Overreaching will be there, overstrain we have to do. So if we are taking something from very far, we have to overreach, or we have to lean more. Okay, so by that also the muscle strain will be there, the nurses will have the backache also. So make sure you are arranging all the articles nearby, so you can do the procedure very easily. So that this prevents overreaching, stretching, and unnecessary wasting of time and the energy. Because see, the things which we are making nearby, so that time how much time and the energy is used, it will be good. Okay, minimal can be used for that. But if we are keeping something very far, so that time we will use extra amount of time also, and extra we are wasting our energy also. So make sure whenever it is that it is a nearby. Now the sixth one, reduce the friction between the object moved and the surface on which it is moved require less energy. So if you are, it means that friction, we have to reduce the friction which from the object we want to transfer and where we want to transfer. So between these two places, the friction has to be reduced. If there is a friction, then make sure it means that you have to use extra force. Okay, so provide firm or the smooth surface to move an object, using a pull sheet to move the patient in the bed. Okay, if the patient is on a stretcher, okay, and pull sheet is there. If pull sheet is there, so very easily you can pull the patient on a bed. But if the patient don't have a pull sheet or something, so what happens? You have to lift the patient. Okay, when you are lifting the pull sheet, no, all the body weight of that body weight of the patient will be equal. Okay, but when we hold something, when we hold the patient, that time all the pressure will be not equal. Okay, so that's why if we are using some kind of mechanics, it can reduce some strain, it can reduce the strain and backache also. So here you can see two nurses are there. The patient is lie down on the bed. They have used the pull sheet. As you can see, the patient is wrapped under the pull sheet. So where they want to transfer the patient from bed to stretcher. So there they can just easily stretch the pull sheet, and the patient can come over the stretcher also. So like this, use the mechanics. So by that also you can reduce some extra strain. Then after seventh one, the wider the base of the support and lower the center of gravity, the greater the stability. So wide the base of the support, it means what it means. We'll see the first example. Widening your stance by keeping the feet apart, maintain body balance while performing the activity like lifting and transferring, etc. It means that, I'll show you the picture. So when we want to transfer something or when we want to lift something, that time we are going to use our feet, right? To make sure you are keeping space between the two legs. So it should have a equal or also and wide enough also. So what happens? Both the legs or the whole body weight will come equally on the feet. Okay, if you are keeping if you are not keeping any space, or the both the feet are not wide enough, what happens, the strain will be used more on the feet. Okay, so leg ache and tendon muscle breakage also can be there. Okay, so make sure like that you are doing. Then after, using the longest and the strongest muscle of the extremities for moving an object require less energy and reduce the musculoskeletal injury and the strain. So when you are transferring something very longest or very heavier, make sure you are using the muscle which is correct for them. Okay, so use your gluteal and the leg muscle rather than the muscles of the back and back when lifting the heavy object. So what gluteal muscle, it is present in the buttocks area. Okay, so gluteal muscles and the abdominal muscles, gluteal and the leg muscles, both the muscles we have to use when we are lifting something. Okay, instead of using the back muscles. So by that also we can reduce the strain while we transfer any heavy object. So here you can see the nurse is trying to shift the patient. So that time she is using their gluteal and the leg muscles instead of the back. Okay, so this also can help to reduce the strain. Okay, then after, the greater the preparatory contraction of the muscle before moving an object, the lesser will be the energy required to move it, and lesser the likelihood of the strain and the injury. So in that example, first we'll see. So before performing a task, contract the gluteal muscle. So what happens when we want to transfer something from one place to another place? Make sure you are preparing yourself. Okay, if you're preparing yourself, so then you know that I need to use the gluteal and the leg muscles more. Why? Because I want to transfer the heavy material. Okay, so that is what contract the gluteal muscles, then after the abdominal and the leg and the arm muscle to prepare them for the action. So here we are preparing all whole body for doing the transfer or lifting any heavy material. So by that what happens, as we know that when we go for the running or something, or doing some exercise, extensive exercise we want to do, so that time what we are doing, warm up we are doing. Why? Because we are activating our muscles for the extensive work. Okay, so like that only here we have to prepare ourselves to make the transfer. Then after, moving an object along a level surface require less energy than lifting it or pushing it up to on the incline. So what it means, we'll see. Push, pull, roll or the turn object instead of lifting them. So what happens when we are lifting some object? Okay, that time we use more energy, but the object which can be rolled, which can be pushed, otherwise pull can be there, otherwise we can roll it, otherwise we can turn it. So in this all the mechanism we need to use very less amount of the body. Okay, less body energy we have to use. So that is what moving an object along with the level of surface. The surface area is the same for moving the object. So that time what happens, this all the mechanic you can use it. So easily the object or the patient can be moved from one place to another place. Then after, balance is maintained with the minimal effort when the base of support is enlarged in the direction in which the movement will occur. So what it means, we'll see first. Example we'll see. When the pulling an object, move the rear leg backward, or when pushing the patient in the wheelchair, or move the front foot of the forward. Okay, as you can see, when we are carrying something, that time what we will do, the rear leg, matlab which leg we are not going to use for a long time. It's like if we walk, so one leg will be back side. So make sure if I am walking, so first I am taking my right leg. Okay, so that time the left leg will be back side. So the left leg backside portion is there, that is known as the rare part. Okay, so make sure you're using that also, okay, while doing some activity. So that distance also has to be proper. If you're keeping very less distance, then also the strain will be used more. If you're keeping more distance, then also it will use a more strain also. So that is what, when the pulling an object, move the rear leg backward, or when pushing the patient in. So what, when we are pulling something, make sure you are backwarding the rear leg also. Okay, when the pushing the patient in the wheelchair, move the front foot forward. When we want to push something, that time what we will do, we will make the front foot forward. Okay. Then after, body weight of the person counteract the weight of the object and reduce the strain on the back. So what it means, why we need to do this, rationale behind this, reduce the amount of strain on the arm and the back. So use the weight of the body as a force for pulling or the pushing by the rocking the feet or the leaning forward or the backward. So here what we are doing, we are using the weight of the body as a force for pulling or the pushing, like a rocking. So make sure you are using the body weight for pulling something or pushing something. Okay, it has to be used in an equal amount also. So it can reduce the strain, and the backache or the arm and hands will be reduced. If you're using only one side hand and you're not using another hand, so what happens, every work or every load will come on the right hand only. So if you're using both the hands properly, so what happens, no strain will be there. So here you can see this person is lifting this article, so that time they are using both the hands equally. When this person, or we can say the nurse, is trying to move the chair, that time also they have used both the hands. And sometimes you can lift that, if it is a lightweight, you can lift it. Okay, so like that also you can reduce some extra strain and the body ache. Then after, continuous muscle extraction can result in a muscle strain, injury and the fatigue. So taking rest between the activity and alternating the rest period prevents the fatigue, back injury and the strain. So what it means, if we are doing continuously this pulling and transferring the patient and something, so what happens, you will feel more tired. So make sure you are taking some rest in between, because sometimes we want to transfer some heavy object, so that time we are using all the strength for moving that, all the things. So make sure you are taking proper rest in between. Take some break period, okay, in between the activities. Otherwise, the alternating rest period also you can do. So if you need to, there is any drug, any medication has came, okay, and you want to move one place to another place. Otherwise, you want to shift the whole ward or whole patient from one place to another place. So that time, all the time continuously you won't be able to do the work. So that time also interval, or you can do some rest in between. Okay, so this can help to this can improve your efficient level also. Okay, now factors affecting body alignment and the activity. So there are some factors which are going to affect the activities. So in that, first one is the growth and development. So growth and development of the person or of the nurses also is going to affect the activity. Then after, the physical health. If the nurse's weight is very less, if the we can say if it is 45 kg or something, so that time that kind of nurse won't be able to lift the very heavy articles, right? So that can interfere. Then after, the physical health. It means that any part have any fracture or any wound is there. So that time also the effort or the energy, or we can't use that kind of energy on that particular part. So that time we have to use another part. So equal force won't be used. Then after the mental health is also important while we move something. If you are disturbed or you are emotionally disturbed or something, so what happen, your mind will be preoccupied. So when you are doing something, so you will miss something and you can fall also. So that also. Then after the nutrition, if you have not taken proper food before doing this heavy activity, because heavy activity requires energy. If you are not taken food properly, then of course you can have a dizziness, so that can be interfere. Then after personal values and the attitude, personal value and attitude of the nurses and the person also going to affect. Then external factors is like, if outside it is rainy, so floor will be very slippery or something. Even though the external stimuli or the environment is also going to affect, even though the light of that and the particular lightning is not there, you won't be able to see anything. Okay, so that one. Then after the prescribed limitation, maybe some article or some patient, if we want to transfer, they have some limitation. So make sure so that this all the factors are there which can interfere with the transfer. Thank you.